Intraspinous ligament desmotomy surgery is relatively new on the scene, and it's specifically designed to treat overriding dorsal spinous processes, kissing spines it's called. The dorsal spinous processes project up from the backbones and create a scaffolding for the backbone, for the back muscles rather, that the saddles sit on. And those back muscles are responsible for the movement side to side and up and down, and provide the strength on the backside of the horse's spine. With kissing spines or overriding dorsal spinous processes, there's a change in conformation of the horse's back. We don't know if it's congenital or if it's something that's acquired from use, in which these dorsal spinous processes actually get too close to one another and interact with one another. They actually touch each other. And by all evidence that we have, both clinical as well as scintigraphy, this condition is inflammatory and painful to a horse.
As you can see, this horse resists my attempts to move or mobilize his back to the point of becoming aggressive. Most horses are supple and willing to move their backs in response to very light finger pressure.
The goal of the interspinous ligament desmotomy is to actually physically separate the dorsal spinous processes by cutting the ligament that connects them. It's a standing procedure done under sedation and local anesthesia, fairly simple. Each horse is different, their level of excitement is different, their level of pain is different, and so an anesthetist is always with the horse at the head, monitoring the horse's level of excitement and pain and movement. Staples are used as markers. When the back is being prepared for surgery, we'll put a staple in the skin so that it can be palpated through the drape later and lined up for where the incision will go. So it's a surgical skin staple that you might use to close a wound, but it's used in this case as a marker. A needle is placed between the dorsal spinous processes that will be separated. The junctions between the processes are curved, and so using the X-ray and as a guide, the needle is sort of finagled or advanced through this sort of curved space so that it's in there, and that way it's something to be advancing the scissors toward to meet them. When the initial incision is made, the large, the heavy gauge scissor are advanced basically bluntly through the muscle until it reaches the junction of the bone. And once the point of the scissors, which are kept closed at first, encounter the space, which you know you're in the space when you encounter, you can actually feel the tip of the scissors touch the needle. The needle is withdrawn at that point, and then the scissors are basically just opened and forced a little bit ahead, and then since they're a heavy gauge scissor, they're closed, and you begin a cut through the ligament. There's a ligament that runs across the top of all those bones, and we were careful not to cut that one. We use radiographs to make sure we're in the right place, also to confirm that the needles are between the spaces we want, to make sure that the ligaments have been cut. And what's nice about the surgery is you see some instant results. The dorsal spinous processes separate as you cut the ligaments, and so you can see an actual physical increase in distance between them as you go down the line during the surgery, so you know you're getting the results you want. A horse may have anywhere from one junction to as many as 9, 10, even in the teens of areas that need to be separated, and so this procedure is just repeated right down the line. The actual incision is about 1.5 centimeters long, so 3, 4, 5 stitches, and then a bandage is placed on the back of the horse at the end of the procedure. The horse may be in the hospital for a day or two after surgery, and be on antibiotics for the surgery, and a couple of days later.
At 6 weeks out from the surgery, I couldn't be more happy with the way the incisions are healed, nor the surgical result. Where before the horse was extremely defensive to finger pressure in attempts to mobilize his back, here you see that he's moving side to side, up and down very willingly, much more like a normal horse will do. So the surgical procedure, as well as the diligently followed post-surgical rehab program, has yielded excellent results.